Okay, it's launching live view. It's gonna be there in about 30 seconds. And we're live on the air. Talking about diabetes. All right. All right, good afternoon. Good afternoon. Once again, Omega Studio has come to give us another dialogue. This afternoon, we'll have the Global Foundation for Family Health. We're going to be talking about diabetes, and diabetes. That is how important that topic is, and that's why we're taking it all the way. Diabetes. I have the studio here virtually, of course. The one and the only, always Dr. Kate Ago, and the one and the only, always Dr. Judith, one and the only, always Dr. Florence. We're going to be discussing diabetes, because we understand from the little research that I did, going from the World Health Organization and the CDC here in the US, it said that 32.4 million US adults have diabetes. 34.2 million, 34.2 million US adults have diabetes. And 1 out of every 5 of them don't even know that they have it. That's scary, right?
Yeah.
34.
That's why it's good to do checkup.
Yes, 34.2 million. 1 out of every 5 don't even know they have it. And it says diabetes is the 7th leading cause of death in the United States. 7th, number 7. Now, diabetes is number 1 cause of kidney failure, lower limb amputation, and adult blindness. As we shall see today, the medical doctors are here to confirm this report from CDC. And it goes again, it says, in the last 20 years, the number of adults diagnosed with diabetes has doubled in the last 20 years. Our viewers, stay tight, don't go nowhere. The discussion is going to begin in a moment, and we're going to do the first 30 minutes and cut it off, take a break. We're doing that because we're learning from you, we're listening to you. Our viewers requested that we cut it down to 30 so they can start and finish one segment. Then we'll go to another. So we'll do a commercial break. We'll get something to drink. We may use restroom break, and then we'll continue like in 5 minutes after 30 minutes. So ladies and gentlemen, the phone line to reach us here at the studio stays the same. Is once again 770-212-9519. 770-212-9519. I'm going to begin the conversation by asking, first of all, since he says that 1 out of 5 that may have diabetes don't even know that they have it, let's start even by asking ourselves, what is diabetes? So, Dr. Kate, please, in a layman's language, what is diabetes?
Hello, viewers. Thank you all for giving us the opportunity again to be here today with y'all. Well, here to talk about diabetes. Diabetes is a bigger issue, as Casey has already said, and it affects our population vastly. Because diabetes is a bigger issue, as he has said, we need to really talk about it in the simplest form that we can so that we'll be able to understand and be able to be on the lookout for that, which is a same signs that will tell us that we have diabetes. But what is it? What is diabetes? So diabetes is, simply put, as a group of diseases that result in too much sugar. So it is a disease condition in which the body's ability to respond to hormone insulin is impaired. Therefore, there is abnormality or resulting in the carbohydrate metabolism, leading to increased insulin in the body and urine. So a condition in which there is body's ability to either produce insulin or inability for the body to respond to the insulin produced, which is resistance. Then carbohydrate metabolism, which is the end product of carbohydrate metabolism, is glucose. So when this body is not able to metabolize this carbohydrate to give us glucose and sugar, then they build up in the bloodstream. There's high blood sugar, high blood glucose, and then there's then there's glucose showing up in the urine because the body is trying to get it out of our system, and it shows up in the urine.
Wow. That's amazing. We will get to the nitty-gritty of the conversation because you did mention insulin and you mentioned resistance. Before we go into that, let's give Dr. Judith an opportunity to tell us in a very layman's language. I know why I'm always saying that, so we don't sound technical. So help us interpret what is diabetes, Dr. Judith.
Hello, viewers. I don't know what part of the world you're watching us from, but good morning, good afternoon, good evening. Thank you for giving us the opportunity today to come back with a new segment about diabetes. Like Dr. Kate put it, diabetes is actually a chronic health condition that affects how your body turns food into energy. Just like she said, it's either your body doesn't make enough insulin or can't use the insulin it makes, as well as it should. So a lot of people are walking around there. A lot of people are walking out there. They're walking around not even knowing if they have diabetes or not. Our moderator said earlier, Casey put it earlier that the CDC, about 34.2 million have diabetes, which is scary. It is so scary because you and I can be walking, eating our food and all of that, eating our food, we have the fried chicken and all of that, not knowing actually what we are getting into. Not knowing what we are getting into. And unfortunately, there isn't a cure for diabetes yet. But the best way to keep yourself healthy is by losing weight, by eating healthy food, and by being active. All those will help you to kind of reduce your risk of getting diabetes or developing diabetes. Thank you.
Excellent. Wow. The conversation this afternoon is going to be interesting because she mentioned losing weight and staying active. In addition to a few other points that she raised, we will get to it, Let's give Dr. Florence, an opportunity to greet our audience and tell us in her own understanding in a very layman's language. Dr. Florence, what is diabetes?
Hello, viewers, wherever you are, in US, in UK, in Africa, wherever you are. I say hello to you. So diabetes, as I've been hearing about diabetes, we have lower one, we have high one. And so most of the food we eat is turned into glucose or sugar for our bodies to use for energy. But the pancreas that is producing the insulin is an organ that lies near the stomach, makes a hormone called insulin to help glucose get into the cells of our bodies. But because of the wrong food that people are eating, so that's why they're having all this problem. But when you are sensing, like symptoms, increased thirst, you want to drink water, increased need to urine, you want to go to the bathroom, increased hunger. And then you have to go and check yourself, maybe you have diabetes. Because if you have low diabetes, that one is worse, very, very worse, because diabetes.
Well, she got to take care of
Sorry,
all right.
they are calling the clinic. The clinic is close today.
Oh, okay.
Just turn it off. Yeah.
Do you think somebody
Sorry.
just have diabetes now?
No.
I'm checking in to see.
All right, go ahead.
The audience. So like I said, so there's low, there is high. When anything that is high is manageable, like high blood pressure or low blood pressure or high blood sugar. But when it is low, it's serious. That the person can die anytime. So that's why I have to watch what we eat. If we eat well, we check our food, you know what you are eating. Not that what you really like. You know, I like this thing, but it's not good for you. But to eat what will make you healthy so that you can live a long life. So some people, because of the wrong food they eat, they're obese, they're very fat. And then they don't know that they have diabetes. So that's why some people, they tell you that they don't know they have diabetes and they just keep on eating what they're eating. And then their blood sugar can go to 500. When they rush them to the hospital, it's too late and go to their brain. And then they die. So that's why it's good to check ourselves. Go to anywhere you can go and do the diagnosis to check you, whether you have diabetes, then to know how to take care of yourself. So because when it is too late, because there's somebody that have diabetes and was just drinking, because he was so thirsty, instead of drinking water, he was drinking soda and making it worse. Then he just rushed to the hospital to check him. But because the queue was so long in the hospital, went to emergency, he was a taxi driver. He left the hospital and then continued to do his work.
Oh.
And at night, he went home. The wife just called 911. They rushed him to the hospital. And when I went, then the wife called me, went to the hospital, and I saw him. The blood sugar has gone over 500. And he was telling me, say, Dr. Eke, please, I'll be drinking water. I said, you are here now. Let them see what is going on with you. But the next day he died.
Oh, Lord.
Because it has been seeing the symptoms, but because he's walking, he didn't have time for himself to go and check until it was too late. Yeah, calling the clinic.
Excellent. Wow. Well, yeah. May his soul rest in peace. We'll get back to the other topics. You could attend to the phone. Maybe somebody really need help.
Yeah.
Dr. Kate is coming right to you. We do have a lot of talking points, but let me just ask, is it everything that has to do with sweetness that we need to avoid as far as eating right? We're not talking about causes. Does it have to do with sweet, anything sweet?
See, it's not really anything sweet because there is a good, you can't avoid everything that is sweet. There is, that's why we have registered nutritionists that will be able to guide any diabetic. But you know what? There's two types of diabetes. Okay, that's actually. Before we go into that, we need to be able to differentiate because both of them are. These diabetics are different types, but they react differently to it. Okay, if we generalize, it's not going to help our viewers. We need to separate them so that they will be able to know which group they belong to and what steps they need to, and how diabetes affects them, as opposed to putting it together, and then it's going to be a little bit confusing because generally speaking, there's two main types of diabetes, but we have another one called gestational. You have type 1 diabetes, which is the one that usually affects children more, teens, young adults. Then I'm going to explain what that is. And then we have type 2 diabetes, which usually we see in adults. But now it is now being diagnosed in children because of increased of obesity that we see in our population these days. So now children are now being diagnosed with type 2 diabetes because of obesity and what obesity does to the body, what overweight does to the body of the cells of the body. That's why they develop type 2 diabetes. And then we have the third one, which is gestational diabetes, which is another type of diabetes, which usually show up in an individual that never had diabetes before and they're pregnant. Then whenever they're pregnant within the gestational age of 24, 28, diabetes shows up. Then you call that one gestational diabetes, which usually, and we usually hope that it goes away after the individual delivers. But it has been shown that most women that have gestational diabetes has a tendency to progress into developing type 2 diabetes within, as they say, 50% within 15 years down the line in their life. So, so let's talk about, because there's different causes of this diabetes, different types of diabetes.
Each of the types?
Yes. So that we'll be able to narrow it down to how each one will be able to benefit and get help if they're seeing the signs and symptoms that Dr. Flo is talking about. Okay. In type 1 diabetes, this is when there's a cell in the pancreas called the beta cells of Langerhans in the pancreas. If they are unable to produce this hormone insulin, what does this hormone insulin do? Remember, it's a hormone that helps push the glucose we have within our blood system, push them into the cell so that they will be able to use it. But if this hormone is not produced in the body in type 1 diabetes, there is an autoimmune. Some children come to you and then crying because it's really hard on children that don't even know anything. And then boom, they say you have diabetes. How do they even understand that? It's really, when you see it, it's heartbreaking because they don't know. Some of them think it's what they caused or what they did to themselves, or it's not that at all. It can be genetic. But they say usually you don't even know, it's sporadic, idiopathic. Some of them just develop type 1 diabetes just because they are exposed to the environmental factors that trigger that autoimmune destruction of the beta cells of the pancreas. So it doesn't produce insulin anymore. And then that leads to building up of the blood sugar. You eat, the blood sugar, the glucose sits in your body without going into the cells that need them. And then you have a lot of sugar, elevated sugar level in your bloodstream, but it's not being made use of. The glucose is not being made use of by the cells that needed them. Then that's the way you have type 1 diabetes. And this group of people are insulin dependent. Because their body can't make insulin anymore, they have to get insulin from outside into their body to be able to utilize and do this function of the insulin their body wasn't able to produce in the cells. Okay. Then the type 2 diabetes we're talking about is this one, your body is able to make insulin. Some of them, insulin is not effective or they don't make enough. So, and then is your body response to the insulin that that is being produced is what will predispose an individual to develop type 2 diabetes. Type 1, they don't make insulin. But the thing is, they said 90% of the cells of the beta cells of the pancreas has to be destroyed before the individual develop overt type 1 diabetes. That's why, like you said, they walk around, they don't know, because gradually the cells are being destroyed. Autoimmune by itself. Okay, these children don't know, and then before they even know what's going on within them, that's when they develop that much symptoms, when at least 90% of the cells have been destroyed. Then that's when I will say everything broke loose. That's when they start showing all the symptoms that we're talking about. Then in type 2 diabetes, your body might be making insulin. Actually, they're making insulin, but then it might be resistant or they're not responding to it enough. Then you develop type 2 diabetes. And I already talked about gestational diabetes, which is a diabetic that shows up when you're pregnant and then hopefully disappears when you deliver the baby. So, and then I don't know if one of that's what because of this, then that will lead us to the risk factors that will predispose you to developing this type of diabetes we're talking about. So I don't
Excellent.
know.
Yeah, I know it's a big topic. It's huge. There's not even 3 days is not enough to go through all the details, but that's why we're here. Good thing is 3 of you are medical doctors with experience, and I am not. So I'm representing the rest of the crowd that are not, medical doctors. So I will always be asking questions that sometimes may not even make sense. But like I said, I'm not in the medical field. So to me and to some of the viewers, it will make a whole lot of sense. Let's give Dr. Judith a chance to kind of dive into it. Tell us the types, like you mentioned, and what comes after that will be the question that I will ask after Dr. Flo as well has given us her own side of the types. So, Dr. Judith, types of diabetes.
Actually, like Dr. Kate said, we have 3 types of diabetes, but we have 2 major types, two main types, the type 1 and type 2. But the third one is the gestational, just like she mentioned. That one has to do with pregnancy. And then the type 1 diabetes is affects children. According to research, it doesn't really have much to do with weight. It has a lot to do with genetics, environment. So kids, innocent kids are just out there walking around, but they don't know that they have diabetes because of the family they were born in, or the environment that they live in, which is kind of sad. And then if we talk about the type 2 diabetes, we are talking about adults. And all of these things have something to do with when the insulin stops producing.
Your body.
When your immune system is kind of weak, so it's not fighting the virus anymore for you. Your pancreas, they all started to the insulin producing cell in the pancreas are being destroyed. So you can't fight the virus or bacteria or any of that because your immune system is down, thereby risking you to develop all kinds of diseases, not just diabetes, but all other diseases included.
Yeah, just clarification on what Dr. G has said.
Yes.
When you say autoimmune, which means that just like the body attacking itself, the cells rise up against itself, a home rise up against itself because of a trigger, maybe from the environment, or just because you're susceptible, individual that is susceptible to that. You already have a genetic factor present, and then environmental factor will trigger that. And then the body will rise up against itself to attack that cells, which makes insulin. So then when it attacks that, it destroys that. That's the autoimmune destruction of the pancreas. This is the cells of the pancreas destroying itself. Then when that happens, that's when type 1 diabetics develop in the individual. And it's not preventable because there's nothing they could have done to stop that from happening. It is there. So when this happens, because some of the children, or some of my patients comes, actually they come and said, okay, because it's really hard on these children, high school and middle school, you know what, I don't want you to eat donuts. You know what, all the children are eating candy. This is Halloween around. You're not going to eat candy. Think about it. They present and then they say, what have they done? to cause them to have a disease that other children are not having. And then sometimes the children usually think that is something they have to, that is contagious. They have to hide from other of their friends so that their friends will not know that they have diabetes. That's dangerous. That's why we really have to tell them, this is not your making, it's not your fault. This is just what happened, and it's not contagious. You can't get diabetes. I tell all my patients, you can contract diabetes. Nobody can contract diabetes from you by sitting by you and during lunch or by being your friend. Yeah, they said, okay, my friends are running away because I have diabetes. If they sit by me, they're gonna get diabetes from me. So it's not an infection. It's not contagious. They can eat with you, but the only thing is, would they like your meal if you really stick to the diabetic meal that you're eating? But they can, by speaking to you, by being your friend, they're not even gonna have diabetes. They're not gonna contract diabetes from you. But they can be your friend, and if you educate them, actually, they will help you in management of your disease condition, because sometimes, like Dr. Flo said, if you are diabetic and people around you are not well educated, it is very, very dangerous, especially for these kids, because the symptoms of hyper, PER, PO is high, PER is higher, PO is low. If they don't know these signs of being low blood sugar and high blood sugar, that is very dangerous, because sometimes they can't help themselves. So we usually encourage teens whenever they come, children, you know what, who is your friend? They tell you, bring them to, if it's possible, bring them. If it's not possible, tell them, look at what I have. Look at what is going on with me. If you see me doing this, then no, it's not normal. Actually, one of my patients, they brought their friend, their close friend, which they're always together. He said, don't treat me, don't say I'm good, treat my numbers. If I go below normal blood sugar, you treat them. If it's below 70, it's going abnormal. If I go below 70, treat me like you will be able to treat me. Give me something. Give me that I need to. Make me eat something, and then take me to an adult. Okay, if you see me, I said, oh, I don't feel good, I don't feel myself, I'm having a blurry vision. If you see me being so sleepy in class, tell my teacher something is wrong. Let them check me out. You know, it goes with teaching and educating the children that, one, diabetes is not contagious. Two, you can infect anybody which is contagious. You can infect anybody around you with diabetes. Teach them the signs and symptoms, which we're going to talk about. Whenever they see in you, they will help you, or get an adult to help you take care of the problem.
Excellent. Let's give Dr. Flo a chance to kind of give us her own background, because one thing I like about this meeting is complete, in the sense that Dr. Kate is there on the what I would call the English medical approach, and Dr. Judith is there coming from the research side of it, you know, the paperwork, all the documented and undocumented evidences. And Dr. Flo is there, the holistic side of it, the natural side of it. So, and then I'm up here looking at everyone, you know, giving the layman's side of it. So it's just complete. I do have quite a few, you know, interesting questions to ask. Let me give, before that, let me give Dr. Flo a chance to give us the holistic understanding of diabetes. Dr. Flo.
Hello, viewers. Yeah, so what I just want to tell people, everybody, is that when we have children in the house, we are the one that will tell them what to eat and what to drink. So if you make it a rule in your house, no soda, Coca-Cola or 7-Up, whatever it is, no soda, just drink water. then they don't have choice. They'll be drinking water. Because even all this orange juice, they put a lot of sugar there, which is not good. So like if our pancreas is not producing insulin, like Dr. Kate said, that is type 1. Because the pancreas that is supposed to produce insulin, and when it produces its insulin, so any glucose in our body, you take care of it. But if it's not, then you have the type 1. And then if type 2 is producing but not enough, that is type 2. But there are some people, they say that, oh, something will kill me anyway. I can eat anything I like. That is their decision. But if you want to be healthy and live long, you have to eat what is good for you. And then you'll be able to help your family too. Because when my children have grown up, my last baby is here to visit me because I'm traveling tomorrow. So that's why I want to rush so that I can see him off. My last one is 27, the 28th in December by God's grace. When they were young in the house, no soda. You drink water. If they go out for them, if they drink something, I don't know, but in the house, no soda. And that's what helped. But when people just drink this, like the person I was telling you before, he was married with 2 children. He was very young, he was 35 years old. And then he'll be drinking soda. And when he was thirsty, keep on drinking soda. When he was first to the hospital, the first thing he told me when I saw him, he said, Dr. Ike, please, I not drink soda, I'll be drinking water. I said, it is too late.
Too late.
Because he went to his brain. They want to do operation for him. The following day, he died. They had to took the body back to Nigeria to go and bury him because he came from a very wealthy family. And that person that he didn't know it was diabetes. Some people can get it from their family, hereditary. But once you have it from your family, you just have to say. Like my husband, I've been married for 37 years. My husband had diabetes. No, had, not now. And because our mom died of it, our father died of it, then I told him, you are not going to die of diabetes. Eat what I tell you to eat. And that's what now, no diabetes, it's gone. You drink water, you don't, all these things, all this, no. We are the one hurting ourselves. Because some people, they live to eat. But you're supposed to eat to live so that you don't die.
Mm.
But not to live to eat. I look at people, I said, what are you doing to yourself? So the best thing is what we have chosen, the way we want to live ourselves, the way we want to be, I want to eat right. Because that diabetes, it causes so many things. It causes kidney problem. When you are eating wrong food, you have diabetes. Some people, they'll be blind. They cannot see. They have glaucoma. They cannot see again. They're blind. It causes some people, when they have just a broken leg, they cut it off. Because of diabetes, it will not be able to heal. It will not heal. So, but some people, they have ears to hear. Some people, they just do what? Like, for instance, so there was a lady yesterday at the clinic that I did assessment for, and I saw her liver. I said, look at your liver. Your liver is not good. Do you drink alcohol? He said, yes, doctor. You have to leave alcohol alone because it's messing up your liver. He said, then what can I drink? I said, it's your life. If you want to continue to drink alcohol and then your liver will be messed up, it's your life. You have to listen to do what's supposed to. Say that, I didn't. Then I say, look at your lungs. You have fluid in your lungs. And then the boyfriend that came with her said that, and then I said that you are eating too much salt. If you eat too much sodium, it will build fluid in your lungs. And then the boyfriend said, yeah, she likes salt too much. She eats a lot of salt.
Oh my
That's
goodness.
it. You have to watch what you eat, to be healthy. Just eat. I told her, I said that if you want to go and buy something, look at the labels. And said that, I eat right, I eat fruits, vegetables. I said, but to go to restaurants, he said, yes. Do you know what they are cooking for in the restaurants? You don't know. All these things, that you are eating, look at you now, even though she's slim, but have all these health issues. And I said that, okay, you have to take care of yourself. Stop drinking alcohol. He said that, how about wine? I said, alcohol is alcohol. Either one or no wine. So it's your choice. I said, stop. When you advise people, some of them, they say, okay, I will change. Some say that, I can't leave that alone. Oh, I have sweet mouth. I want something sweet. And at the end, you will blame yourself. So all the problem we're having in this world, we are causing it by ourselves. Like people have high blood pressure, and then you don't eat right. You are eating too much salt, and then you go to the hospital. You say that, oh, you have heart failure. You have this. You will soon die. Let's do this thing for you. Let's do this operation for you. During the operation, some people can die. But if you say, thank you, I'll change my diet, I lose weight, I'll be okay. So many things in this life that we are causing for ourselves.
Excellent. This is going to be interesting. One of the reasons why it will be interesting is because this is a sickness that almost everybody has.
Oh, yeah.
And like we said, when we start, we're going to do 30 minutes and take a break. That way we'll do it in segments.
Okay.
Viewers, we are not in a hurry because what we're doing right now is groundbreaking. It's easy for us to come here and say type 1, type 2, type 3. It will become just the same old story. Mm-hmm. But we're taking it easy to build up the understanding so that anyone that is willing to learn can learn as far as what to do to stay healthy, dietary. We all know it's very, very hard. So when we come back, we're going to be going into dietary. What is it that we need to do? From what I've gotten so far, the body produces insulin.
Oh yeah, the
pancreas. If the body is not able to produce insulin sufficient amount, then you go to type 1 or type 2 and type 3. So what is it that we need to do? Like Dr. Flo said, you go to a restaurant, you want salad, but the salad that you're eating, you have all the toppings made of sodium and to a greater percentage. Now, your alcohol she mentioned, and Dr. Kate, of course, with her physical everyday practice, hands-on, she talked about people come to her and stuff like that. And then the research from Dr. Judy. So viewers, don't go nowhere. This is going to get more detail and more interesting. In the next 5 minutes, as we'll come back, we'll go real deep into it and we'll dive into it and we'll give you the understanding that your life can be changed. Because one thing I know, they always say, I don't have time. And I've told people, yes, we don't have time to eat right. We don't have time to do things right. Dr. Judy talked about exercise. We're in a hurry. You know where we're going to? God forbid, but it will come. We're hurrying to the grave.
Oh, yeah.
And when we get to the grave, there will be enough time to sleep non-stop. So why hurry to get there? See that? So let's not be in a hurry to get to the grave. Viewers, I encourage you, don't be in a hurry to get to the grave. Stay strong, stay healthy. We will hear more from the medical professionals